Breaking news. West Virginia Wesleyan is experiencing an enormous STD breakout among their campus. Recent information is showing us that HIV, chlamydia, and herpes diagnoses have spiked in the past 3 weeks. For more information, we're going to go to Tessa and Rachel at the Residing Campus Health Center for more information.
Here we are with Nurse Angie at the Health Center to get more information about STDs on campus. How important would you say that this is?
How important?
Yeah, and how serious is the matter?
It's very important. There's an average of 1 in 4 students walking on campus with STDs right now, and most of them probably don't know or are not aware that they are carrying them.
How dangerous would you say the STDs are?
Well, it depends on which STDs we're talking about. The number one STD, so the top 2 STDs nationwide is human papillomavirus, also known as HPV, and chlamydia. And those are the 2 top STDs that are here on our campus right now, that I've seen many students coming in to seek treatment for those things. The first one, chlamydia, can be contracted through oral sex, anal sex, vaginal sex. It can be cured through the use of an antibiotic. But the problem is for people who get antibiotics over and over and over again, they run the risk of chlamydia maybe not being able to be cleared, which means the antibiotic won't work anymore. For people who are walking around campus who may have chlamydia and don't know it, they may not recognize the signs such as yellow discharge, vaginal discharge, or penile discharge, itching. There can sometimes be a rash or pain. It can cause infertility later in life, and you may not be looking to have babies now, but when you turn 30, you may decide you want to create your own children, and you're going to find out that it's really hard to do. As far as the HPV is concerned, HPV virus, there are over 150 different versions of the virus. You can get that through oral, anal, or vaginal sex. You can also get it through skin-to-skin contact. The big issue with HPV is there's only one way for it to be tested, and that is through a pap smear. So if you have it in your throat, or if you get it through oral sex, or if you are a gentleman and you don't have any signs or symptoms, you can pass it to somebody else, and you'll never know you passed it to them. The other big issue with it is when you're older, when you're 30, 40, 50 years, you could end up having a cancer from it. It's one of the #1 causes for now esophageal and throat cancers. It's also one of the big #1 causes for cervical cancers, penile cancers, and ovarian cancers. So it's really important to use protection. And the only ways to prevent chlamydia or HPV from being transferred is through barrier methods such as condoms, dental dams, things like that. The only way to help reduce the risk of HPV is to get the HPV vaccination, which you can get only until you're 26 years of age, and then it's no longer recommended. There are 2 vaccinations that you can get. The first one, there's 2, it's a series of 2 vaccinations to make this complete series, and it covers for the 9 most common HPV viruses out there. 2 of them are the vaginal warts or genital warts, and the big issue with HPV, if somebody has warts on them, what makes it scary is they're probably very high risk for having HIV or some other immunosuppressive disorder, which means their body is not fighting infection like it should, because we should never ever have a wart break out on us from HPV.
So would you say that the ways to prevent this, are they offered here at the health center or other places?
The HPV vaccination can be given either at your doctor's office, community care, or Care Express over by Buffalo Wild Wings, the health department. I believe Rite Aid will also give it out if you walk into Rite Aid and tell them you want the vaccination. We do not offer it here because we do not bill insurance, and it makes for a very, very expensive vaccination that will be completely 100% covered by insurances. by the way our health insurance is set up right now. Oh, for chlamydia, I can treat that here. We have state programs, and I can do it through the family planning, but I prefer to do it through the state program because it's less paperwork, so, and it's free.
Thank you so much for helping us today with spreading the STD awareness and teaching how important it is on campus. Well, there you have it, folks. Now we're going to switch back over to Jordan and Savannah to get more information about these current STDs.
Thank you, Tessa and Rachel. As you just heard from our reporters, STD breakouts are becoming a serious issue. Here in the studio, we are going to give you more information about one of the most common STDs, herpes.
There are many things you should look out for when looking for herpes. Some of the symptoms show up 1 to 3 days or longer after having sex. Other symptoms are flu-like feelings, small, painful blisters on the sex organs or mouth, itching or burning before the blisters appear, blisters lasting 1 to 3 weeks, or blisters go away when you still have herpes. Blisters can also come back.
How you get it? Spread during vaginal, anal, or oral sex, and even possibly genital touching with someone who has herpes can cause you to obtain the infection.
If you don't get treated, you can give herpes to your sex partner. Herpes cannot be cured, and a mother with herpes can give it to her baby during childbirth.
Now we're going to head over to Megan and Zach for more information about some more common STDs among campus.
Thank you, Tessa and Rachel. Now let's move on to HIV spreading on campus. Now Dutch, put that thing away. I'm Megan.
I'm Dutch.
All right, and here we go. We're going to talk about HIV. So symptoms show up several months to several years after contact with HIV, the virus that causes AIDS, can be present for many years with no symptoms. There's also unexplained weight loss or tiredness, flu-like feelings that don't go away, diarrhea, white spots in the mouth, and in women, yeast infections that don't go away.
HIV can be spread during vaginal, anal, oral sex. It can also be shared using needles for drugs and contact with infected blood. It can also be spread from mother to child, from in the womb, birth, and during breastfeeding. Downside is HIV cannot be cured, and it can cause illness or death.
And that's all we have for today.
That's it.
She on my dick, she nigga left to do ass tricks. Hit the splits and do ass tricks. She a bad bitch with ass tits. Make the dick disappear like magic. Now take them fucking clothes off. Let me get a straight tease.
Hi, Poppy!
This is just weird.
Hi, Poppy!
Who's Poppy?
You're Poppy!
Why am I Poppy?
Yeah, you're me, Poppy! See?
No bueno!
See?
No bueno!
See? Oh!
Oh!
Are you using protection?
What's protection?
Hi, Poppy!
Don't you forget about me. Don't you forget about me.
While this video was made to entertain, STD prevention is a very serious matter.
You can find many different types of protection and contraceptives at your health center.